Good morning, everyone. I think most of you know me on the call. I'm the president and CEO at United Ag, and welcome. This is our first town hall, right, Maribel? We are
That
starting
is
this town
correct.
hall. I think we've never done this before, so we are super excited at United Ag to do this. But as we reflect back, so we had a meeting earlier this week that we had to cancel, and as most of you know, the things going on in Southern California, it is really sad and we kind of feel it more because we are an hour away from the destruction. So it is a lot of things happening from an emotional standpoint. People have lost their houses. So when we reflect back at United Ag and think through this, right, anything at United Ag, we always say we put the humans at the center of everything that we do. And as we are looking at what's happening, and it's so close to home, yeah, at United Ag, we think of health, right? But when you really think about a health, and that's just not the medical, dental, vision that we do, and the things that are happening today and what's going on impacts our mental health. And so at United Ag, it's not just our medical and needs or dental needs and vision needs that we take care of, but when we're looking at it from a big picture, it's the mental health that's impacted right now. And as some of you might remember, in 2020 when COVID hit, and we had something we had no clue what was happening. At United Ag, we felt that again, our ag industry was impacted from the anxiety that created, the mental health issues that created. And at that time, we had a partner called Spring Health. And we were just actually talking to this vendor, right? We had no idea we wanted to implement this. And here comes something that we did not understand. And we started understanding the impact that this has on our psyche and anxiety it creates and the stress that it creates. So what we decided, and kudos to our board and our team here, we decided to offer this benefit free of charge for our members. So this was zero copay, nothing deductible. You could actually use Spring Health for that year that we had anxiety issues. From that started a relationship with Spring Health and what that meant to United Ag to take care of mental health needs of our members. And now we are excited that we are taking the Spring Health benefit to the next level. And as these issues happen, not just natural disasters, but things happen at employer sites, and there's so much need for this, right? And when you really think about it, we kind of think medical help and mental health and kind of separate the two, but that's all connected. And we have to take it when we say empathy and we want to take care of people, we have to not just address what we see from a claim standpoint, but we have to go deeper and take care of our members. So with that, I want to introduce what we have from Spring Health. So Peggy, can you introduce yourself and talk about what additional benefits we've added through Spring Health?
Yes, good morning. Thank you, Kirti. Good morning, everyone. Thank you for joining us today. We are so excited. I am the Senior Claims Director for United Ag, and we are so excited to introduce our partnership with Spring Health, especially during this time when there is so many people experiencing trauma in many different ways. It could be you personally, it could be somebody in your family, it could be a friend and a coworker. There's just so much impact in what's happening today in California. Spring Health now has a program partnering with us for crisis assistance, for substance abuse, tobacco cessation, support in these times when things are so crucial, and we need that mental support, that holistic approach to our health from a mental aspect. So Spring Health is here. We will have links to documentation and support materials on our website. Just go out to our website and you'll get all of the information you need to get the support during this difficult time, and to be that support afterwards, you know, as we continue to navigate this challenging situation that we're focused with.
So Peggy, it's not natural disaster is one, right? That happens. I'm in California and fires. and they are even on site. You talked about crisis management and what's happening. And this was triggered actually last year when one of our employers or members had an issue going on their site and they needed crisis management. And that's where we started the conversation, right? And we are implementing this now.
Correct. It was not about just what's happening today, but it's what's happening. There's things that happen in the workplace. There's situations that occur that we need that support. We need to be able to have a resource for our employees, our members, where they can go and just have that support to navigate the challenges that may be presenting each and every one of them. So this program, we are really, really excited to be able to offer and have our members utilize when they need it.
Yeah, thank you, Peggy. And I think, is there a Q&A, Maribel? Are you looking at the chat? Are there any questions that somebody had?
There's no questions at the moment. There was just
okay, good. You're monitoring it. I just saw the chat come up, and I just wanted to make sure I don't miss somebody's question. So thank you, Peggy. When you also look at, so Peggy, you work with a lot of vendors and at United Ag, and anytime we look at vendors, right, we're looking at these relationships and putting our members at the center and saying, how do we help that? So you do that on all the relationships that we have had. We have our pharmacy benefits. So Sachin, you kind of help with the pharmacy benefits, even from our relationship with our PBMs, right? We look at everything that's needed from a membership standpoint and help out the members. So what are the resources right now that we have from Costco that we can help our members with?
Absolutely. Good morning, everyone. Sachin Varma. I'm part of the underwriting team at United Ag. So very similar to what Spring Health does for our members, Costco Health Solutions is our pharmacy benefit manager. They also introduced a disaster declaration policy a few years ago, actually, right around when the COVID hit. So any members that need to fill their prescription drugs early can go to their pharmacies. All they have to make sure the members will simply need to advise their pharmacy that they need to fill their prescription drugs early due to the fire, or it could be any disaster. It doesn't have to be the fire, but since we're dealing with the fire, we'll talk about that. Once they go in and talk about that with their pharmacy, all the pharmacists will go ahead and take the override off from the prescription. So if you can fill up your prescriptions, early if you have to. And Costco has been very supportive for our members, Costco Health Solutions. And they also introduced a $0 generic copay last year in 2024. So any copays, if you have a generic copay, let's just say $10 or $15 copay, which is typical in our industry, is to have a copay on your prescription drugs. Costco will waive that copay to $0 if you fill up generic copays at Costco pharmacy. So you do have to go to a pharmacy at Costco. You don't have to be a member at Costco to go fill up the prescriptions. But if you do fill up any generic, you will have to pay $0 copay. Where at other pharmacies, so if you go to Walgreens or CVS, you might have to pay that copay upfront. So that's another Costco Health Solutions as a partner of ours is doing that for our members, our employees, and it's been working great for last year. I just want to kind of give them a shout out because they have definitely stepped up and be a really good partner for United Ag for the last 3 years.
I know Sachin will talk a little bit later about this, but when you're looking at partners, right, like I was talking about Spring Health and others that we have the relationship with Costco too, one of the reasons we choose the PBMs and what we do is also from the transparency standpoint, right, that we have. And I know Costco is getting out of the PBM business next year, and we are working on getting a PBM that fits very much similar to what we have with Costco with the transparency model, where we know what's going on. So everything that comes in goes out to the members, and everything that we are talking about today continues to happen, and even more from a membership standpoint and giving back.
Yeah, 100%. So our goal is to find a replacement for Costco for 2026. And it's nothing against Costco. They have been a really good partner for us, but they are exiting the market, the PBM, Pharmacy Benefit Manager market, starting off next year. So we do have to look for a different partner. At this point, we are doing a full RFP to find the next partner for us, and we have really good candidates, actually 3 candidates that will be going out to the RFP with. Our goal is, like Kirti said, not just to match what we have today with Costco, but exceed that. Full transparent to our members, whatever, the cost of the medication is, we pass 100% of the cost to our membership, our employer groups, and that's our goal going forward. So we'll be coming more on that as we go along in the year, but I think we have some sort of decision by July, August of this year, who the next PBM partner will be.
Yeah, and we will have like a webinar or something and make sure we have that information out as soon as we do. So from a transition standpoint, from ID cards and all that, it'll be covered. And we'll talk a little bit more later on that.
Yes.
And Sachin, when we are looking at it, Peggy talked about how Spring Health and the cost to a member if needs come up, right? You just talked about Costco and the $0 copay for generics, right? The same way we have another benefit that people can use, which is 20 minutes or sometimes less from where they live. So you want to talk a little bit about that, and even from all this is happening, how can we support from there?
Yes, absolutely. So Elite Wellness Centers is our clinics that we have 6 clinics throughout California. And these clinics do have on-site visits. The wait time is technically a lot of times 0 minutes. You walk right in. You don't have to make an appointment. You walk right in, get seen by a clinician. They also introduced last year a virtual visit because a lot of our members were having a hard time making it out there. So if you're, like Kirti said, a lot of times it's within 20 minutes or so. But sometimes if the distance is too much and you're taking too long to drive out there, that was some feedback that we did get from our membership over the years. So last year we introduced a $0 virtual visit with our clinics as well. So now all you have to do is just call the number and you can talk to the clinician. A lot of times it's the same clinician that you go see when you go to the brick and mortar clinic, but you can have a virtual visit with them at no cost to yourself, to your members. And that's been launched since 2024. We have been very successful in that. A lot of our membership has already started using that. So I just want to make sure everybody's aware of what they have as a benefit for their members, and maybe just push more on that, because our goal is to keep the cost less, our trends less, and we'll talk about that in a few minutes. We'll get into the trend, but some of these things when we do, like going to the Costco Health Solutions or Costco pharmacies to fill up your prescriptions, Spring Health, what Peggy talked about, Elite Wellness Clinics, all that does is keep your overall cost low so we can pass the good rate increases back to you when the time comes for the renewal.
And even from a members, you and I using the healthcare, it's the cost to us is less when you walk into a clinic. And we were talking to a new member recently on our new member call that we had, and to walk in where you don't have to wait in like 30 minutes to be called by your PCP, and then you go in and you change and you put on your gown and wait another 30 minutes. You don't have to do that at the United Ag Health and Wellness Center. You walk in, you can get your appointment as quickly as you walk in and walk out, and it's at zero cost to you, right? And if anybody is interested, listen to my podcast with Stan, who is a provider in Salinas Health and Wellness Center, provides kind of the mindset of what we bring to the health and wellness centers. And the reason virtual care with our health and wellness center is slightly different than Teladoc is because you build a relationship with Stan, and let's say you are an hour or 2 hours away from Salinas and you want to call, you actually talk to Stan because you know him, you get to know him, and then that carries forward. So that's a great benefit we have. And just looking at it from everything that we do when we are providing benefits, right? So when Hana is looking to hire people in our different departments, we actually look at this and say, how can we give back to our membership? Because service is at the forefront of everything that we do. Even when we're talking about numbers that Sachin brings back, we'll talk about later, it's because of putting the employers and the groups at the front and center and working on that. And Sonia, if you can introduce yourself, because Sonia is, I think the reason everybody feels it's sometimes hard. Sometimes you have to leave United Ag and you kind of feel, because I don't want to leave Sonia. And that's what Sonia means to United Ag. So Sonia, you want to introduce yourself and talk about what you do?
Yeah, good morning, everyone. My name is Sonia Roldan, and I'm with the Member Services Department, where we also have an advocacy program in our department. And what we do is really what's been discussed already with Peggy and Sachin. We're able to facilitate all these programs that are available to our members. And in moments of crisis, really, the advocacy was really designed for that, for members that have just been diagnosed or struggling with getting information or going through a situation. We've seen in the past that we've had several fires in the past, and we've been able to help those members get their medication, as Sachin has brought up. Be able to work quickly with our vendors as well as with the member to ensure that they're getting their proper care or their medications that they need. And any questions that they might have, any concerns that they might be experiencing at the moment, be able to send them where they need to be sent. If we have to transfer them to the wellness clinic, which we work very closely with, and also through to our teledoc program, our Spring Health program. So we're able to be there for the member and support them and help them through those difficult moments that they go through.
So Sonia, how many members, how many reps do you have, and how does your structure look in member services?
Yeah, so I have about 15 reps currently, and we have about 8 of them are in member services, which they're just answering calls, ensuring that those calls are being answered promptly. Less than 45 seconds is our goal. And our goal is also to be able to resolve the issue in a phone call if necessary. If that's really our goal. But if not able to, then depending on the complexity of the situation, it might be something that requires additional research, or it just something that's very critical and needs immediate attention at the moment. Those get sent to our advocacy team that are able to triage and contact the member right away. It's within minutes of a member calling, and we start really researching and contacting the member or the provider if we need to, calling the pharmacy, understanding what the situation is and what the member's needs are. So it goes through the advocates at that point.
Mm-hmm. So Sonia, I know this is your passion, right? You kind of shared yesterday in an internal meeting that you're grateful that you work for a company who's very aligned to what your value system is. So what is that, and how do you hire, and what do you look for when you hire people in your department?
So I was sharing that, and to me, really to care for people and help them in their time of need is really important. When a member calls in, it's really not just a member, but it could be a parent. You're looking at somebody's son, somebody's daughter, somebody's uncle, somebody's grandparents and parents. So to me, that's very important that they get treated equally. And they get served just, with what they need. And it's important to all of my team, not just for myself, but my team is very empathetic to those situations as well. And they feel exactly the same way. So through the interview process, we ensure that we are hiring the people that are going to be able to serve those members, especially, making sure that they're bilingual, making sure that they understand, the quality of service that we're trying to provide to our members, and ensuring that they understand how crucial it is in some situations. And I think my team does a wonderful job in providing a quality service to our members, because it's really about the quality, not the quantity. So we're not managing how many calls we get per day or how many minutes are you taking on a call. It's really whatever time it requires you to solve the issue for the member. That's as long as it has to. We're on the phone with them.
Yeah, and that's very, very important to us at UnitedAg, right? So we are using technology behind the scenes, but in facing the member services department, we look to expand that and make sure we anything and everything. If you haven't, some of the people their houses have burned down and stuff, and they just want to talk to someone, feel free to call us and Sonia's team, and we are here to help. So thank you, Sonia, for doing that. As I had mentioned, Spring Health and the crisis management, the person who is front and center and understanding from an employer needs what is needed for our employer. So Donna, if you can come in, because you understand the employer needs, and you are again come in from empathy and that what you look at when you're looking at benefits. So you want to talk a little bit about what client services and your team, what they do. And crisis, the one that Spring Health thing was your idea when last time, because you realized one of our member groups had an issue and you wanted to reach out and help them.
Thank you, Kirti. My name is Donna Bars, and I oversee our client and field service team. I hope that many of you have had the opportunity to either meet or work with a client service manager or our field service team. We work closely with our service reps to support our member groups and help them in open enrollment meetings, employer health initiatives, flu vaccine campaigns, and a lot of education. So our field service team are the ones that you might see out at your office in the fields. In fact, we have teams right now in Yuma out in the fields helping do open enrollment meetings. Excuse me. So part of what we're committed to do is, when you hear about all these benefits, is how do we communicate that to your employees? And sometimes it might be one-on-one meetings, sometimes it might be hosting a help fair, and our team is there to help you with that. The client service managers, and we all have dedicated client service manager and field service reps. So your company has a dedicated client service manager and a dedicated field service rep. And the client service managers work closely with the employer groups and the reps as well for their renewals, their open enrollment meetings, and if there is maybe an escalated issue. So Kirti was talking about, some of the issues that people have encountered recently with regard to maybe a sudden death or, God forbid, something, greater than that. And so our client service team is a resource for you. It's like something happens and you're like, I don't know what to do. I know United Ag has lots of benefits, but I don't know how to incorporate that into my organization and how to access it. So you can call your client service manager and we will listen to what's going on and we will help navigate our resources, whether it's bringing in, the member service team, reaching out to Hannah, for her resources, going to GA for, whatever we need. So that's kind of our role is that hub. And so you don't need to know, just like you go to Sonia if you're a member and you don't know what's going on, you call Sonia and her team will help you figure out, what you need. As an employer group, if you have a situation, then you can reach out to us and we will help you navigate those different resources that we have available. And so.
Yep.
Thank
so
you.
As a member, reach out to Sonia and as an employer, and your field service rep, open enrollment, you know how much of a hassle it is, right? But open enrollment time for HR teams, anything that we can help to take that stress off of you, let us know. Even service reps on the call. I know most of you reach out to Donna. She is a big support. So thank you, Donna, for doing
Thank
what
you.
you do. So one
Thank
of the
you.
things that as Sonia and others we all go outside, right? We hear things from our members and they give us feedback. And based on the feedback, we make a lot of changes at United Ag. One such member last year had an HSA plan and they said, how come Saeed does not have an HSA, right? And that we realized, oh, that's true. And we went back and took that feedback and we had our team look at it. So bringing Peggy back. Peggy, you want to talk a little bit of Sain, about what we are doing with Sain, and then Jason, if you can fill in from what that means from a legal standpoint.
Yeah, Jason was, part of helping us just coordinate with Sain to accept our HSA plan and offer them care and services as any other one of our plans. Jason, you want to expand on how that is going to work with Sain for our HSA members?
Sure. The biggest challenge for our HSA members accessing our Sain services was that as an HSA member utilizes services, they're accumulating to meet their deductible. so that they can have United Ag begin paying for services. There was no method or process for us to work with Sain on HSA plans and for them to feed that information back to us so that our members could, number one, take advantage of the negotiated discounts that we have with Sain, and then for the member to get credit for paying for those services. So Peggy and I worked together with Sain as well as our IT team, and we now have that process where when a person goes to receive services at Sain, they'll pay the negotiated rate that United Ag pays, and then they'll receive credit towards their meeting their deductible, so that at some point, once they meet their deductible, they won't have to have those out-of-pocket costs, and United Ag will start paying, and they'll have their percent co-insurance or their copay based on their plan design. So it's really a nice benefit for our members who are in the area where they can utilize Sain, and they can now utilize it just like any one of our other members on other plans.
Thank you, Jason. Thank you, Peggy. And that's, again, we take it back. We researched it, and Jason and Peggy put their heads together, and our members ask for it, and we deliver. Right? That's United Ag. And as we were, it's asking for what is needed. One of the things that all of you have asked for is a portal, and not just from an employer standpoint, from a member standpoint. So Chenny and her team have done a lot. Last year researched it the first couple of months to see what exactly is the need of our membership, and come back and delivered. So Chenny, you want to introduce yourself and talk about what's coming with ID cards, our app, and our portal, all the exciting things that we have going at United Ag.
Thank you, Kirti. Yes, we just launched a brand new portal at the beginning of the year. It's the benefit administration portal for our employer, our member, as well as our service rep to process enrollments, access ID card, EOBs, their benefits. In addition to that, we launched a brand new mobile app that is a direct connection to the benefit portal as well. When emergencies happen, you kind of don't know where your ID card is at, so the mobile app has instant access to the ID card that you need. As well as EOBs, you can email your ID card to the provider right at the doctor's office as well. The benefit portal is a more intuitive benefit system, and a lot of quick access that is available for the users as well, and has more immediate communication tools. And on top of that, so those two just launched the beginning of the year, and we are coming later this year. We are going to introduce another avenue of accessing ID card, which is called a native wallet. And what that's going to do, it's going to send your ID card to your mobile wallet, your Apple or Google wallet. And it's just like you getting a boarding pass. It sends it there, and then another way of accessing that information.
And we are at this point testing it out
Yes.
with our employees, and it works great, right? So you can
Yes.
actually pull up like you do in an app. And Jenny, can you talk if I want to access the United Ag app? How do I go about doing it? Is it just on Apple, Google? How do I do that?
Oh yes, that's right. You can access and download the United Ag app. It is called United Ag Benefits Connect. You can get that on the Apple Store or the Google Store, and it's quick, easy download, and it's for our members, so it's not for the employer at the moment or the service rep access. It is the members' direct access, so they and their dependent can download the app and register. And then we also, since we just launched it, we created a sign-up contest for the members and their dependents. So registration for the first quarter, they'll be entered to win entered into a raffle and win $25 gift cards. We have 100 of them. So encourage your employees and their dependents to download and register, and they'll see how easy it is to use.
And I think, did we talk about that when the 100 person signs up, maybe it's going to be a big raffle and not just a $25 gift card. So if you're the 100th one, you might win something really big. And
Yeah,
the
well,
200.
correct.
The
Yeah,
100.
we'll do some milestone in between those $25 gift cards as well. So if you're the 100th person to download our app, or get us to 1,000,
Yeah.
and we'll get prizes for them as well.
So Jenny, when we talk about anxiety and stuff, right? If I'm in the HR department, I'm just an employer, and I hear Sachin talk about a pharmacy benefit changes coming in 2026. And I know I don't like doing that because of the ID card issues and how I have to deal with my employees. So all the things that you're working on, how does that impact with ID cards?
The great thing about having the mobile app, as well as the new digital wallet that's coming, is it's instant. I know that in previous years, we've sent PDF ID cards to the HR team, the service rep team, but having the mobile app or the digital wallet, as soon as we send the file over to our vendor where they're going to print or they're going to produce the PDF, as soon as they get that file, the card is instantly available in your hands on your phone. So hopefully that reduces the anxiety of having to wait for the PDF copy or waiting for the physical copy. Now you can just open the app and then you have it, the connection's already there.
So in December 15th, I go to a doctor and I open up my app or the digital ID, right? And it shows Costco as a pharmacy and it's all there. But Jan 1st, if I go, it's automatically going to be updated and in there.
Yes.
So I don't have the anxiety of the ID card not being received, right? I still
Correct.
might get the paper card, but that might be delayed or whatever it is. But meanwhile, you can go to a doctor and have everything digital is going to be just quickly updated, right?
Correct.
That's excited. That's what
Yeah.
you are excited about.
Correct.
And that'll be exciting for Donna's team and Sonia's team because from a calls and stuff, that becomes anxiety around December, January time. I know how service reps are also anxious about that. So that's going to take that off. So that's going to be
Correct.
exciting. Thank you, Jenny. So when Jenny, we talked about this last year, right? So we were looking at how do we innovate, how do we take United Act to the next level? And out of that came this portal, the mobile app, and the digital wallet, because this was all kind of taking United Act to the next level. And so we also were, so as we are going through the year, we take feedback from our members, we take feedback from our service reps, we go out and explore other options, right? And talk to other tech. There's a lot of things happening innovation wise from technology. And we go explore that and see what is it that we can bring back to United Ag. So once just such group, Talon, we met with them last year, mid-year, and we wanted to test it out and see what does that do to United Ag. So Laura, you want to introduce yourself and talk about what's up and coming, what to expect in 2025 and 2026.
Hi, yes. So I'm Laura Garza, Senior Operations Manager. And as Kirti was talking earlier on about building our vendor relationships, we did partner with a company called Talon for a pilot program that we would like to roll out to, a selected number of groups, members, just to kind of test it out and see how this works. But this tool that they offer is called My Medical Shopper. And what this tool does, it creates a personalized price comparison shopping tool that will help our members find and access affordable healthcare services that they might be seeking. So it's just like that, going and kind of shopping around. So if you need to have a surgery or just an office visit or flu shots or whatever might come up for our members, it gives them the visibility to just see and compare costs with providers or facilities near them, or maybe a little bit further out, there might be a provider with less cost and better ratings. So this tool will give that visibility to see where those costs might benefit them. It also displays the members' out-of-pocket cost, deductibles, what's going to get applied. So it takes all of the information on the member's plan and puts it and displays it. So it reads that. And how this is possible is that this Talon vendor uses nationwide machine readable files, special pricing arrangements, and historical claims to produce that accurate provider procedure pricing data. Besides just showing the your cost to the member, it also shows an encounter estimate, which means kind of a breakdown of what the provider would possibly be billing the, United Ag or the insurance, the breakdown of that. So it may be knee surgery, but then there's also components that will also be built into that. And so it gives that member that breakdown and that visibility to see what that cost really is. So sometimes the local one is not the best. Sometimes just driving 5 minutes more or a little bit 10 minutes out will give the member a better service and lower cost to them. So our goal with the tool is to ensure our members are navigating to low cost, high quality care facilities, and then help them save money from their out-of-pocket expenses. Another component that was part of the tool is a rewards program. This will kind of drive our members to choose those high quality providers for medical services. And it also entices them with some incentives, right? So the tool can also be linked with fitness apps like Apple Watch, Google Fit, and help motivate those members to, be healthy and happy. So more to come on this program and this tool in the coming months, but it is going to be a pilot program just to see how much engagement we get and usage out of it. So.
And we will partner with the employer groups to offer some of these incentive programs. And we also trying to see if this then can be tied to renewals and what that means as the employers engage more in the wellness programs, right? So it's going to be a lot of partnership, a lot of back and forth, but this gives us a tool to measure that, gives us a tool to incentivize people, because health and wellness centers, sometimes they are 5 minutes away and the members don't know that, and they end up going to an urgent care which is not great service or great. You don't get as much going into the health and wellness center. You get actually better taken care of better than going to the urgent care. So things like that we are testing out. So this is a lot of work is going on behind the scenes. And even from Laura, just looking at it, right? If I'm just trying to see if I'm not price comparison shopping, because I might not be incentivized to do that, right? Who cares? United is paying for it, an employer is paying for it. Why would I care? But what this also offers me is, if I'm looking for it, is to show where I'm at from my deductible, from my, right? So it gives me a whole picture when I'm making some of these decisions.
Yeah, absolutely. I think there's still some possible out-of-pocket expenses, so that the member might incur. So just shopping around and looking at providers in your area and kind of just seeing that gives that visibility. Like, oh wow, if I went to a health and wellness center, which is closer, it would have been $0 for me for a copay, or anything to my deductible, versus something that you're just comfortable going to, not realizing that, oh, I have to pay a $15 copay. This one's 0, this is 15. So it's saving money for the member, not just United Ag, but also just the member especially. And then the cool
80%, right? The 80%. Yeah. Go ahead.
And it also like indexed our claims. So the member can go and see our claims utilization. So let's say that they didn't shop around, right? But if you go to the tool, it'll show the claim, and then it'll show, hey, this claim like gives you 3 alternatives that you could have went to and saved you some money, right? Or save some costs. So it looks at it also from after the fact and gives you some possible, solutions or other places you could go or could have went.
Yeah. And this is from medical standpoint. We're looking also to see if we have a pharmacy partner who does something similar. So a lot more exciting stuff coming. This is just a part of what the innovative ideas going on at United Ag. And when you look at this, right, so Talon and everything else that we've done, and as we were talking and connecting with our members, listening to our members. So it's a really important part of how we are building United Ag. And I know, repeat this over and over again. I feel like United Ag is not just one of us or to the executive team or here in Orange County sitting and creating this together, but all of us doing this together, right? It is not my United Ag or this team's United Ag. It's all of us on the call. All of us, our members, our employer groups, our service reps, because we see everything everywhere out in the news of what's happening from a healthcare standpoint, from what's happening from a care, how the service has been happening, the denials, and all kinds of things happening. So why don't we use United Ag as a lab, even each one of you on the call, to test out and see what works, what does not work. But how does that happen? How do we listen to our members? How do we engage with our members and get feedback? So I want to ask Christina and Bridget to join. Introduce yourself. And can you talk a little bit? I changed this around a little bit. Hannah, I'll have you come in a few minutes. So Christina and Bridget, can you talk a little bit about what you are doing? Because how are you listening to members, right? And how here today we are just talking, but how do we make sure we get to listen and hear what's going on? So talk a little bit about that.
Thank you, Kirti. My name's Christina Morley. I'm the Strategic Client Services Manager, United Ag. And as you've heard from everyone who's spoken today, we are not a conventional health plan. You know, we have a unique responsibility to meet the needs of the agricultural industry. And we fundamentally understand that capturing the unique perspective of each employer, each service representative, and using that perspective to shape our product experience is really our value proposition. And so our goal is to create ample platforms and really ask intentional questions about your experience so that we can capture that perspective. And you may have seen over the past year, our health benefit forums, different trainings that we've orchestrated. We're really trying to create roundtable experiences where we're listening to each of you, your perspectives on the industry, your perspectives on your niche in ag, your experience with our health plan, and really using that to drive changes forward so that we're not just innovating off of intuition, but we're really innovating off of what matters to you.
Hi, everyone. My name is Bridget Sanchez. I'm Chief of Staff at United Ag. And just like my colleagues mentioned, and even Kirti, we're really building United Ag based on feedback. And our ask to you is, if you're interested in helping us build a partnership and contributing to shaping our product and our vision, we encourage you to coordinate a call with your service rep or your client service manager, or even feel free to reach out directly to Kirti, Christina, or myself at connect@unitedag.org. We really do want to hear from you, your perspective on our product needs, your industry, and your experience.
Thank you. And it's connect at United Ag, and that's the way. So yeah. So Bridget, Christina, and I have access to this. So connect at United Ag. We're always looking to get your feedback. And if you want to schedule some time one-on-one with Christina and Bridget, I would love to have you jump on a call. We've done quite a few last year that we've talked to new members who joined United Ag. We've talked to service reps, what works, what does not work. What can we do, right, to help? So please reach out to us and schedule a call with us. Would love to talk to all of you. So because this is, let's build this together. Let's change together, change the conversation around healthcare. This is United Ag. Being part of United Ag is a little bit more than just providing benefits for your employees or for yourself. It is being part of something really big. So let's do this together. So thank you, Christina and Bridget. Excited about the projects.
Thank you.
As we are looking to connect, right, there are different ways we connect. So Hannah, you want to talk about your HR roundtables?
Yeah, hi, good morning, everyone. My name is Hannah Halpin. I'm the VP of HR here at United Ag, and been here about 10.5 years now with a few decades of HR experience behind me. And what I do for the members is we try and build a network between all of the HR, our HR Ag members. So while I'm not the ag HR expert, we find you that support, and we build that network together amongst all of you. So one of the things that we do is I do an HR roundtable. And we paused it a little bit during COVID, but we're back again now, stronger than ever. And we do in-person roundtables, and also we're starting virtual roundtables. We now have partnered with a legal firm who specializes in HR ag, and they'll be for immediate issues or changes. I know there's a lot of things going on up in Salinas currently with ice and things like that. So we would have an on-the-spot virtual webinar for people that need support with some of those issues, and how they can handle that for their teams, and how that impacts them. So we're super excited, really learning from each other, and you guys all building that network together. So by attending the roundtables, they're, we pick a topic that's relevant to you, but it's very conversational, and the goal is also to connect all of you together, to become each other's best resources. So I'm always here, I'm always available. If I don't know the answer, I'll find the answer. I'll find someone who knows the answer. So I'm always here as a resource. So thank you.
Thank you, Hannah. So reach out to Hannah and join her roundtables, because that's the way of connecting with United Ag.
And we have a lot of fun. It's
And,
a great way to spend an hour.
And before I go to Maribel and the other communication ways we connect, quickly wanted to see of all those things that everything that we do at United Ag, right? We cannot do it without being financially sustainable. So all our goal is to giving back to our membership. And the way we do it also is to make sure we are financially stable. So we are super excited to announce we are a $250 million company right now. Excited to be at our contributions, and that shows we have record number of new sales this year and 2024, and just going into 2025, the first 2 months we've had record sales. That kind of validates that, like what I said earlier, people are in it, joining United Ag to be something more than it's just providing healthcare, right? That's what United Ag is all about. And a couple of years ago, there was this whole discussion on surplus and what's happening. So anytime what happens at United Ag, when we had COVID hit us, at that time, we went into the COVID years being financially very strong, high surplus, very strong in financials. COVID hit, and what do we decide? We decide giving back was the most important to us. We did not think of what it meant to United Ag, what it meant to each one of us, but it was how can we give back to this industry. So we offered Spring Health at zero copay, no deductible. Anytime a member was impacted and a renewal happened, and we realized that how much of a hardship that member had, we said, let's go back and give them back a better renewal so it's sustainable for them from a financial standpoint. We saw how this industry was hurting, right? So we did that. And of course, when you do that, what happens? You deplete your surplus. And we intentionally did that. We wanted to make sure we're giving back, and we knew we would build that back, and we did. So as in 2020, 2021, 2022, right? And then we slowly started seeing that from a financial standpoint, the impact on surplus, we came to a point where we said, now we need to build that back. And that was extremely intentional. And so we are super excited to announce to all of you that we have over $100 million in assets right now. And we are around over $40 million in surplus, which is a very good financial position. And at the same time, making sure it's not from our renewals or pricing that happens. We made sure we did it in a way where we made sure we kept our renewals consistent and made sure we give back to the membership at the same time building. So it's a very hard thing to do, to balance the two, but we have successfully done that. So we are super energized. So thank you, all of you, for being part of that, because this tells us something, right? This shows in numbers. When you put humans at the center, it actually shows in numbers that it is important. So we're financially in a very, very strong position. We cannot have the financials up here. We could have had that and showed that, but just in 2 or 3 months, we should have our audits and stuff done. And as soon as the audits are done, our financials will be released to all of you, and you can look at it and get excited and feel proud about that, because you are a big part of why United Ag is where United Ag is. So that's, and Sachin, if you want to come back in and talk about, as an employer, as a member, what does that mean for them when United Ag is so financially right now in a strong position? And what does that mean for an employer or a service rep, or even as an employee using it? What does that mean from trends and what to expect in the coming years?
Yeah. So let me maybe touch upon the trend. So like Kirti mentioned, financially, we're very stable now. We are passing on good trend increases to our employer groups. So this is our second year for doing that in a row. Last year, our trend was 6.5%, and this year for 2025, our trend is 6.8%. So keeping that trend in that 6% range has been very tough, but we've been able to do it for 2 consecutive years now this year. And the way things are going, because I know it's only January right now, but we're already working on May renewals at this point. Looks like we're going to have another good year. We already started the year really strong on new business sales and retention. So we're hoping we can probably keep that trend very similar to what we had for the last 2 years. I just want to give you a perspective of what the trend looks like for other competitors. So in California, it ranges from anywhere from 8% to all the way up to 15, 16%, the trend. So that's what kind of our threshold was. So we wanted to make sure we're giving back to our community, we're giving back to our members. And a lot of the programs that we talked about throughout this presentation helps our keep our trend low. The whole health and wellness clinics that we talked about, SAIN network, the Spring Health, the Talon is a great tool that will also help lower the trend. All these things that we have in place, Costco Health Solutions is another factor, is helping our trends to be lower than our competitors. So we're really proud of that 2 years in a row. We're hoping 2025 will be another great year like we had last year. 2024 was a good year for us. We're keeping the momentum up, and hopefully we can pass on the lower trends back to our employer groups.
So every time you're looking at a renewal on your business, you're looking at it from the member standpoint, then because we are in a position right now to do it.
Right now, we're in a position to get back. Right. Exactly.
Yep. Thank you, Sachin. So Maribel, you want to talk a little bit quickly about all the other ways we connect with our members, and then we'll have Jason talk a little bit from an advocacy standpoint on what we can do as an advocate for some of the things, especially when things are going on, like the way I started.
I wanted to actually remind you, we have a new RN. I don't know if you want to introduce her, and then I'll jump back on.
Oh, that's right. So Peggy, where are you? You want to talk about our case management and what we're doing?
Yes, back again. And I do want to introduce Cristina Portillo. She joined us just before Thanksgiving. She is an RN. She brings with her a long history of case management, and we are partnering together. Cristina, you want to talk a little bit about how we're going to move forward with helping our members with their clinical needs and how we can support in that area?
Yes, good morning, Peggy. Good morning, everybody. So happy to be here. I'm just beyond excited for 2025, really hoping just to walk alongside my colleagues and really looking to help coordinate good quality care for our members. Just really excited to make sure that we're kind of going hand in hand and making sure that our members are as healthy as they can be, and that services are being just coordinated in the best interest all the way around. Health is obviously, just like my colleagues have mentioned before me, it isn't only the physical aspect. There's just so much more to health. And so just really walking side by side, hoping to bring my community and clinical background into play and bring great things for 2025.
So Cristina, you're going to look at claims and stuff as you're building a claim, as we are building the case management with you and Peggy kind of doing that, but also looking at it from the empathy, because you come in from a background where I think you said your favorite place to work was hospice,
Yes.
and how you offered kind of care at that and what that meant to you and what you learned about empathy and what that means. So we are excited to have you at United Ag because this is front and center of what we do, right? So I know it'll be balancing the two, compliance. We have Jason, you, Peggy, balancing what should be approved and what should not be, and at the same time making sure. So that's the way we hire, right? So when Peggy, you were looking for somebody to bring into the position, that was important for us to see because case management is different things to different people. For United Ag is very different. United Ag is making sure it balances the human and the compliance and the all that balances, and then how do we keep that balance? So
Yes.
thank
Yeah.
you.
Thank you.
So, Maribel, do you want to do it or do you want Jason to end and then you give resources later? How do you want to do this?
Yeah, let's
Since we
have Jason talk because he's got some great stuff about SPD.
All right.
Okay, well, first we'll talk a little bit about advocacy. As Kirti mentioned, each year we try and engage more and more with all of you to make sure we're representing your voice in Sacramento. And last year, with it being an election year, we had a very exciting, engaging election year with many candidates that we really had close relationships with and supported, and we now look forward to continuing those relationships with them in Sacramento and carrying your message to them. And so we plan on doing that once they all get settled here. It's only January, but I've already talked to a few of their offices for some of our new elected officials, and look forward to visiting them in Sacramento and talk to them about our United Ag family and your concerns. And so each year we do a survey. We'll be doing that again here shortly. I suspect that the topics will be consistent with the last few years, but we still want to make sure that we're reaching out and getting your feedback and hearing what your concerns are. And as always, every time I have the opportunity, I welcome all of you to engage and get involved in advocacy. And I think you all know how to get a hold of us, but when you can email our communications team, or if you have my email directly or my phone number directly, please reach out if you want to engage in local advocacy or advocacy in Sacramento, because our voices really do make a difference. The phone calls, the emails, the visits, they really do make a difference when we're trying to communicate and pass messages along, whether that's water issues, pesticide issues. Right now, obviously, we have wildfire concerns. And when we have built those relationships, the people that we're talking to are much more receptive when it's not a cold call. This is someone that we have relationships with, and we talk to multiple times as we go throughout the year. So now we're in a position where we can be a resource for both them and you, and leverage those relationships and make sure that we're passing information along that's valuable.
And then, go ahead.
Go ahead.
Are you
Nope,
going to
go
talk
ahead.
about the feedback that we got regarding what's covered, what's not covered, and what decision you made on that?
Yeah, so I was going to transition to the SPD.
Okay.
So again, hearing the feedback. I've been here a few years, and there are a few service reps on the call, as well as our groups. And Sachin, Kirti, and I and others have heard some feedback about our documents, and it does take some time to make some changes, but very happy to pass along that for 2025, we will no longer have a exclusion for hazardous activities. And again, very early on, heard that was a concern for many of our members. And we've now made that decision after, looking at what our exposure was and the impact it has to our members, and talking to, again, many of our service reps, that we wanted to make that decision this year that we are no longer going to have that exclusion in our documents. So that's the biggest impact on our 2025 SPD. That's the biggest change. The other one that will impact not as many members, but I think it's just as important, in that occasionally Peggy and I will run across a claims decision where United Ag is a secondary payer and the primary payer will deny something related because they don't believe it's medically necessary, but United Ag does think it's medically necessary. So we now put the power in our plan document that if we are a secondary payer and we believe that a primary payer incorrectly determined something was not medically necessary, we can step in and say that we think it's medically necessary, and we will step in as the primary payer because it's what we think is the right thing to do.
Cool. And all the topics, I know we covered quite a few topics, and Maribel has a list of the ways she connects, but all of this, we will have webinars, the ops forums to go dive deeper into it. And if any one of you wants to reach out, I mean, Jason, there might be a lot more questions on this. There might be questions on something that Peggy said or Sachin said or Donna said. Reach out to us. We will have other ops forum. We just had one for the portal and ID card. And once things happen, we will have more ways of connecting with you and getting this information out. Even Christina, she's new to United Ag. She's going to be maybe at some of the events at United Ag. So you'll get to see her, get to understand where she comes in and what her thing of providing from an RN standpoint would be. So excited to connect with all of you. Maribel, do you want to talk about your list, or do you want to send that in an email later of all the things, the way you connect with our members? Because behind this was Maribel's idea to have this town hall, and we were all excited to host this. So thank you. She's always putting the members at the center and saying, how do we connect more with our members? And a lot of stuff happens behind the scene from Maribel. So excited, even for this, right, Maribel, you might want to ask, did it work? Did it not work? What else can we do next year when we do this event again? So Maribel?
Thank you, Kirti, and absolutely, our communications team takes pride in really being an internal and external resource for our members. Thank you so much for taking the time to join us today. And as you can see, the organization has grown a lot from just an association to an association health plan to full circle, really providing support for every single department in your organization per se. And we really are very happy and take pride in that. And so with that, we have many programs that focus on specific key things, which I'll send out a list because like I said, it's so many, which is a good and a bad thing at times. But please feel free to submit your questions. I know we're already at 9:03 and there's some questions that came in. And so we do want to continue the conversation with you. And for those of you that have not signed up for the conference and you've never experienced the conference, I really highly encourage you to join us. We turned 45 and that's not a small milestone. That's a very important milestone. And it's nice to see that we're turning 45 and the organization is doing great. And we want to continue to share that with all of our members and prospecting members and hopefully even expand it right on a national level. Why not? All ag should have access to quality benefits and services. And, you know, we're very happy and proud of serving this industry that we love so much. So with
And
that,
Maribel, we'll send after this, you will send any Q&As come in,
yes.
we'll send that information. And Jason, there was a question on what's covered and what's not covered on the hazardous we'll send that list. Again, this was based on our ag industry and needs because ATV and other things happen in the ag community, and there shouldn't be an exclusion. So we'll send all that detailed information later and any questions, and please follow up. There are different ways, Maribel, you connect with our members. So reach
Absolutely.
out to Maribel, thank you, all of you, for making the time. Thank you.
And if you'd like to see more feature programming such as this, maybe we connect quarterly, let us know. We're here to serve you.
Yeah,
Thank
and
you,
more
everyone.
importantly, I know this, like I said, again, we are super proud at United Ag of what we have achieved and what we can do, but this is not our win. This is everybody on the call, everybody calling in. This is your win, because if this can be done, then it can be done anywhere else, especially right now with all the things going on regarding health plans and how the healthcare industry is and how complicated it is. if United Ag can do it well with the team that you have here and be a financially sustainable, a $250 million health plan, then it is doable. So let's send that message out. Let's be part of something bigger than just offering healthcare for our health insurance for our members. And just wanted to end on our heart, and everything goes out to people who have been impacted by fires. And California is a hard place. We have wildfires every year, and it is hard to see all the things that have happened. But at the time like this, we are here to help you out. So please reach out. So thank you.
With that, thank you, everyone. Have a wonderful
you.
week. Bye.
Thank you.
Bye.
Bye.
Thank you.
Bye.